So the ambition for mental health is to support the health of our population, is to focus on population health improvement. We also have the South End Essex and Thurrock mental health strategy. Imperative to that is about being cognizant of the notion that there's no health without mental health. We know that there are some inequities in provision, and I think there are going to be some great opportunities just harnessing the opportunities of becoming an Essex entity as a whole.
Yeah. Yes, and it's about making sure that all the services that we have across Essex are all aligned and working collaboratively with all partners, working with our local authority partners, VCSEs, community services, and our acute trust as well.
So I think it is important to celebrate successes. I think this was an innovative idea, something moving away from our traditional ways in which we've commissioned service. It brings together at the heart of it partnership, collaboration. And I know we speak about collaboration and partnership, but this is demonstrable of collaboration partnership. What better way to have the VCSE working with an NHS provider and a community interest group as well.
Yeah, and it's good to hear all these success stories about it today, and also feedback from people with lived experience, which is very important because you commission all these services, but feedback helps to shape all the services that we have. So, yeah, very positive to hear all the feedback around the services that were commissioned just a few months ago. And yes, so it's just the beginning because obviously we're moving across Essex footprints, and it's to to take on the lesson learned from this and ensure that we carry on with it and it's rolled out across Essex as well.
We want to support people in Essex to feel well. And we want to ensure that the services that we commission, the services that are delivered, and the services that are provided have an optimum outcome.
I think it will be very, very important to have our voluntary sectors working with partners and also in line with the neighbourhood health. That is the main vision now, is around working collaboratively with our voluntary sector partners to ensure that they're embedded within the system. So that's the plan, moving away from treatments to prevention. And our voluntary sector partners are very key in delivering that and making sure that that vision definitely is fulfilled.
I think the key is to see the voluntary sector in the truer sense of partnership and ultimately working purposefully with the VCSE in terms of all intervention prevention. So for me, the key is how do we engage with the VCSE? We know that the voluntary sector can mobilize at pace in terms of ultimately supporting with quicker putting services together. And so ultimately the aim would be key partnership, being part of as key stakeholders and moving away from the traditional tokenistic approach, but making sure that the voluntary sector are seen as significant partners. So we look forward to continue working with the VCSE and being part of the wider partnership. There are lessons, there are opportunities, but I think seeing the little steps and acknowledging and celebrating some of the successes, but acknowledging that there are some great strides and we need to continue to work and support the population.
We look forward to working more collaboratively and ensuring that VCA partners are engaged with and they are engaging with us as well purposefully.